Good morning and a pleasant day to all. I'm happy and honored to be with you as we kick off the 2020 National Productivity Conference. I am Maria of the National Productivity Commission and the Executive Director of the Commission. Alam po ninyo, we hold the National Productivity Conference every 2 years as part of our mandate to conduct advocacy on productivity improvement. The conference is usually of tripartite composition. So today, we are joined po by our commission and board members from the workers, employers, and the government sectors, headed of course by our Honorable Secretary Bello. I am happy to see that we have more than 500 participants inside the conference room and more than 7,000 watching us live from Facebook. So thank you po sa inyong lahat for being with us this morning. Dahil po bawal ang face-to-face meeting, we decided to conduct the productivity conference using the virtual platform. We have 9 webinar sessions to be conducted every Thursday, same time at 10 o'clock from September to November of this year. So without further ado, to formally open our conference, I am honored and happy because despite his busy schedule, we are privileged to have him with us this morning. Colleagues, may I respectfully introduce to deliver his message for us, Secretary Bebot Bello III, who is also the chairperson of the National Wages and Productivity Commission. Sir, you may now have the floor, please.
I-decrease, we're just trying to reconnect Secretary Bello. Meron lang tayong konting disconnectivity.
Okay. So while we're waiting for the secretary, baka pwedeng DED Pati, we can already pull up the questions, the poll questions, and then bigyan na lang tayo ng signal if the secretary is already there.
Okay. Thank you, Director Chris. Good morning, everyone. I am Patty, co-hosting this webinar. So before we start, let me just pull up some poll questions. As Director Chris said a while ago, just to put in sync our mindset to today's topic. So may I request the first poll question to be pulled up by our technical support. Okay. So our first poll question is a multiple response question, and it goes, what changes in the way your company does business do you expect in the new normal? So do you expect changes in perhaps by way of increased automation of business processes? Do you expect more online transactions, or do you expect new work arrangements or new products and services, or perhaps new skill requirements or others? So since this is a multiple response, you can take as many as applicable. But please don't forget to hit the submit button after you've ticked off your answers. So maybe we can give the participants around 25 seconds for this poll question.
Present.
Hello.
Hello, Criselda.
Hello. Patty, excuse lang. I think I already saw the secretary. Sec, I actually have already introduced you early on. So we're so happy that you are around to grace our occasion. This is the first time po that we're going live when it comes to conducting the National Productivity Conference. As you know, before we do it face-to-face. But this time, just to let you know, sir, that for this webinar, we have more than 500 participants in the Zoom room itself and thousands of viewers in our FB Live. So without further ado, Sec, may we request you to give us a short message po, please.
Okay, Criselda, thank you very much. My dear friends, our partners in the private sector and organized labor, friends in media, my fellow public servants, magandang umaga po sa atin lahat. Pera na si COVID. I am pleased to open this virtual forum series, a very important initiative of the National Wages and Productivity Commission. The pandemic may have prevented us from physically being together, but I assure you it will never lessen our resolve to fulfill each of our tasks and our obligation. This undertaking is a landmark edition of the biennial series, not only because their very meaning of productivity itself seems to be incongruous in today's stark realities. This is more so because we are holding this in the historic juncture of a disease-induced labor work, recession, and the realities of the future of world of work. So let me commend the National Wage and Productivity Commission and its partners for the wisdom to continue this series. I believe that it is during crisis where our worth as servants of the public good is tested. And it is during disasters that our notions of what the world is are likewise tested. These include the notion of productivity and competitiveness in a time of production slowdowns, social distancing, and the human imperative of surviving over and above other imperatives like labor and production. We may not deny the crippling effect of the pandemic, but neither can we deny the human desire to create and produce, not war or strife, and neither can we deny the Filipino spirit to develop and advance to this, not disease nor disaster. We are one of the most resilient peoples in the world. Alam nyo naman yan, and we firmly believe in the notion that every dark cloud holds a silver lining, that every tragedy has a revival, and every death a rebirth. I am grateful to all of you for lending your insights, your expertise and experiences on how best we can move forward from near economic catatonia back to surging productivity and economic vitality, and how we can overcome the challenges posed both by human and natural debacles, while also harnessing the realities of the future of work and quickly adapting to its advantages and potentials. As the world therefore starts to get back on its feet, and as we start to put our economy back on track, we look forward to your insights and your collective wisdom on how to best erect the landmarks as we renew our journey toward a world where we are all citizens of a better normal. May you have a fruitful and insightful forum. Maraming salamat po and magandang umaga sa inyong lahat ulit.
Salamat po, Sec. Salamat po for your very insightful and inspiring message. Karagdagan po doon sa mga nabanggit ni Secretary, nais po namin na sa pamamagitan nitong webinar na ito ay magkaroon tayong lahat ng mas malalim na pananaw at pangunawa sa mga challenges and opportunities din na dulot ng pandemic. Kaya gagamitin po natin itong platform na ito para maparating ang mga polisiya at programa na makatutulong sa ating lahat to bounce back with greater resilience to drive productivity in the new normal. So with our lineup of topics and resource persons, we enjoin our webinar participants to engage our speakers by typing your questions in the question and answer box. So at this point, we will proceed to the main session. Our first webinar is very interesting po because it is all about ReCharge Philippines. So may I request at this point, Director Patty Hornelia to moderate the session from here. Thank you, everyone. Director Patty, you may now have the floor. Thank you.
Thank you, Director Chris. If we can continue with the poll.
Sir.
I will move out. Balik ako dun sa press ko ng EDA at DOF. Okay, thank you very much and good luck po. Babalik din ako kung meron pang time, ha?
Okay po, salamat po, Sec.
Okay, thank you again, thank you.
Okay po. Director Patty, sorry, please.
Can we have the first poll question where we stopped? Again, can we flash the first poll question?
Hindi na.
All right. So again, this was the first poll question. So can we give the participants another 10 seconds just to complete answering the question? So for our next poll question, can we have the next poll question up, please? This is, again, a multiple response question. So we invite you to click as many or tick as many as applicable. And the question reads, what do you think will be the most difficult challenge your company will face as it transitions to the new normal? So will it be maintaining employment? Will it be supply of raw materials? Or is it the market or demand for your products and services? Is it government regulation, access to technology, and others? I think I'm reading from the chat box that some of them cannot see the poll question. So we have 20 seconds to answer this question. Again, please don't forget to hit the submit button after you've checked your applicable responses. Again, cue to the technical. I think I'm reading from the chat that they cannot see the poll question, but it's flashed in the screen. Salamat po.
Aprobado.
Bitaw na?
Kasuya ka.
Bitaw na?
Wasya o.
So are we done with the second poll? Okay. Can we pull up the last poll question? Okay. Oh, thank you. Some are responding to the chat box saying they're done. Thank you. So for the last poll question, how confident are you that your company will fully recover in the new normal? So this is just a single response poll question. Are you very confident, or do you feel somewhat confident, not confident, or you have no idea, you don't know? So again, please click submit after you've clicked on the button. I am seeing the chat box and they're saying, a lot of people are saying they're done. Thank you for participating in our poll question. Thank you. We can pull up the We can remove the poll questions now. So thank you very much for answering our poll questions. The results will be shown after the presentation of our resource person. So provide us an overview of ReCharge PH, which is the presentation or the topic for this morning, we would like to welcome the Assistant Secretary of the Policy and Planning Group of the National Economic and Development Authority. It is a privilege to have with us this morning on such a very short notice, Assistant Secretary Carlos Bernardo Abad Santos. ASEC, the floor is yours. Welcome.
Yes, good morning, and welcome to this webinar series on national productivity, which is sponsored by the NWTC. I'd like to, the topic for today's webinar is on ReCharge PH, and it is the work of the task group on recovery under the National Task Force. Again, I'd like to give an introduction on the topic, and I'd like to share my, can I share my screen? Is it possible for me to share my screen?
Yes, ASEC.
ASEC.
Okay, there. Okay, so there you go. Again, this is the introduction to the presentation of Undersecretary Edillon, who is also currently right now in the press conference on the July round of the labor force survey. Just to give you a heads up, the PSA this morning just released the results of the July round of the labor force survey, and gave the report that unemployment for July of July 2020 went down from 17% in April to 10% in July of 2020. So we are not yet near the pre-COVID levels, but we are slowly opening up the economy, and again slowly restarting business and work. So basically, at this point in the COVID pandemic, our response now would call for rebalancing our priorities from saving lives from just COVID-19 to saving lives from both COVID-19 and other factors. And this is really in terms of, again, saving lives because of hunger and other factors, not only with regards to the health aspect, or those saving those who are infected by COVID, but also on other social and economic factors. And basically, the framework used and being used by here in the Philippines and also other countries is really the hammer and dance theory. So the issue is it suppression versus mitigation versus do nothing early on. So the hammer and dance basically, if you do nothing, then you continue to increase COVID-19 cases. Mitigation, you mitigate, however, you still continue to increase COVID cases. The hammer is really a blunt force solution in terms of you basically do lockdowns. And after that, you cut the virus growth. And because of this quarantines or the lockdowns, you give time for virus growth to be cut down, at the same time to build healthcare capacity. Then after that, slowly opening up the economy, slowly easing the quarantines and the lockdowns, and then you do the dancing part or the dance part, and then again in this latter second part is that again we will have some spikes, recurring spikes, but then they can be controlled. And important to hear in this dance part is to balance both health and the economy, the impacts on health and the economy. Important also here is proper testing, contact tracing, quarantining, and isolation. And again, removing restrictions. However, there's a need to tighten up when needed. And indeed, we experienced that we went to GCQ. However, we had to again tighten up and go back to an modified ECQ. So again, the important thing at this point is to balance health and economy, and again to also address both health and economy at the same time. Now, we started in April to May, the Interagency Task Force, the IATF, created the Technical Working Group on Anticipatory and Forward Planning. That was April and May. And basically, the tasks of the TWG for anticipatory and forward planning at that time was to address uncertainty by providing the right information. Again, sometimes it's only giving the right information to address uncertainty. However, it's also we also need to address uncertainty by addressing losses experienced during the ECQ, and again, preparing for the new normal. So that was the task given by the IATF to the TWG on anticipatory and forward planning. And in less than a month, the Interagency TWG, headed by NEDA, discussed all of these things, and again came out with We Recover as One report. And this report can be accessed, the entire report can be accessed in our NEDA website, and it's stated here in the slide. Now, an important part of the We Recover as One report is defining the new normal. Because in defining what the new normal is, we can develop and come up with strategies on how we can adapt to the new normal. And which is also important because as we gradually recover from the pandemic, we enter into a new era of the new normal. So it's important to anticipate what this new normal is, and so that we can formulate policies, programs, projects, interventions, and activities that would make us adapt to this new normal. Now, on the general context, what is the new normal? And from the study, based on, again, looking at what has been written, and again, crowdsourcing or getting feedback from the general population, we can define new normal in several contexts. In the most general context, the new normal would mean that physical distancing will still be observed and face covering will be required. So again, moving on, even going to 2021, we would still be doing physical and social distancing. Second, there will be strict hygiene and sanitation protocols. Again, we continue going forward to the rest of 2020, 2021, even beyond. We will have to adhere to strict hygiene and sanitation protocols. The third is that sporadic lockdowns is possible. And indeed, we've seen this since March of this year until now. We're already September. We've seen that sporadic lockdowns can be possible. And in fact, moving forward, even though we've beyond COVID-19, again, threat of pandemics or health disasters or health emergencies is still there. So again, sporadic lockdowns can be possible. And finally, the looming COVID-19 threat will be foremost in the minds of the individuals. So nakatatak na yan sa atin na okay, either COVID can come back or another type of virulent disease can come back. So again, this is the new normal. And again, in adapting to the new normal, it's important to look at this context in terms of what the new normal is. The new normal can also be characterized in terms of the political sphere. And again, here, new normal would mean increased attention towards managing multidimensional risks, such as public health emergency and natural hazard events. Again, moving forward in the new normal, we see that LGUs will be taking on greater responsibility to deliver public services, especially health and social safety nets. And again, we've seen in this experience how important LGU's role is in terms of addressing and coping up with the COVID-19. There will be a greater need for targeted interventions, and hence there will be a greater need for disaggregated data, because we've seen that again, it's not only beyond, let's say, having the data for the regions and the provinces. It's important also to see the data at the municipal and even barangay level, because your interventions would be differentiated. And if you see much more disaggregated data, then you can see more surgical or more targeted interventions at different levels, at the barangay, municipal, city, and the provincial level. We can also characterize the new normal in terms of economic. And again, we see that there will be higher household demand for, we see the change in demand of the different households. And basically, this impacts in terms of the household expenses. And we see higher household demand for health products and for health boosting goods. So yung mga, a lot of these supplements, these vitamins and minerals, healthy food, we see that. Higher demand for soap, hand sanitizer, and alcohol. Higher demand for face masks. Higher demand for internet. And we see that, again, connectivity is very important. And again, both internet and electronics would be important. We'll see increased demand for connectivity, hence demand for internet and electronics at the household level. And utilities, that's electricity, gas, and water. I think mostly electricity, since a lot of people will be working from home, then you see higher use for electricity, for air conditioners, and power at the house. And again, we see higher household demand for bikes and motorbikes. There will be lower household demand for durables, especially in the immediate term, non-essentials, and then tourism and travel. Again, there will be, in terms of demand, there will be higher investment demand for delivery vans, for motorbikes. Again, investment for digital connectivity. So again, you would see a lot of firms and companies, again, putting up additional capacity for digital connectivity. A lot of investments for electronics equipment and in storage facilities. And we see lower investment demand for air transport and for office space. In terms of demand in the government sector, we see higher demand for digital connectivity. And we've seen this across government offices, that it's important, again, as they shift their frontline services from face-to-face to online, and they shift analog to digital frameworks, then you need both digital connectivity and electronics equipment. Increased demand for healthcare services, increased demand for healthcare personnel, and increased demand for social protection. And across government, the new normal would see lower demand for office space. In terms of exports, we would have, there will be higher export demand. Again, this is actually because there'll be increased demand in other countries. So we'd see higher export demand for electronics equipment, healthcare supplies and equipment, healthcare services, healthcare personnel, and again, it depends on the type of BPO. In some areas there'll be higher demand for BPOs, but in other areas there'll be lower demand. So it depends on the areas of BPO. And we see lower export demand for travel and tourism. Now, stimulating the economy is very important in terms of amid COVID-19. And again, there are these the COVID threat and the impact of COVID-19 basically impacts on both the demand side of the the economy and the supply side. In the demand side, we see here the consumer, that's consumer, that's consumption, so that's consumption expenditures, investment, government expenditure, export minus import. And again, the COVID threat would dampen the demand. So again, it's important to again address this COVID threat. And again, in terms of supply, the COVID infection will impact your supply because again, it will impact in terms of the production, agriculture production, industry, among others, manufacturing and services sector. So again, it's important to address both the COVID threat, which is important to build the confidence so that consumers will again start spending more, start making more investments, and again, more government expenditure. But we also have to empower production capacities to capture this demand. So we need to make sure that we can be able to restart and sustain production, agricultural, manufacturing, and services. So again, we need to address both the demand side and the supply side of the economy, and that's basically the reason on why a task group on recovery was formed at the National Task Force. Again, there were task forces earlier on that were created to address mitigation, to address response, and to address strategic communication. And last month or a month ago, the National Task Force, as we are already entering, restarting the economy, the National Task Force created a task group on recovery, chaired by NEDA, and the members are the Department of Finance, the Department of Budget Management, the Department of Trade and Industry, the Department of Interior and Local Government, and the Department of Social Welfare and Development as the core members of the Task Force on Recovery. And ReCharge PH is actually the hashtag of the task group because, again, we need to recharge the economy. We need to restart the economy. After, again, the lockdowns and the quarantines imposed as early as March of this year. And again, the task group and recovery, the main objective of the task group on recovery is to formulate action plans and monitor the same that will facilitate the restarting of both social and economic activities while engaging all of society in preventing the spread and mitigating the effects of COVID-19. So again, it's looking both economic and social, at the same time addressing, restarting the economy, but also making sure that we prevent the spread and mitigate the ill effects of COVID-19. There were 3 sub-task groups created under the task group on recovery. And these are the sub-task group on economic recovery, sub-task group on social recovery, and sub-task group on governance. And the objectives of the sub-task group on economic recovery will be to engage business and the workforce in the fight against COVID-19 and expand economic opportunities amid the pandemic. The sub-task group on social recovery, the objectives is to improve the capability of Filipinos, whether individuals, families, and communities, to thrive under the new normal. And the sub-task group on governance is to ensure people-centered, clean, and technology-enabled and responsive governance in addressing COVID-19 and restarting social and economic activities. So again, this task group on governance look at support strategies and interventions to support both economic recovery and social recovery. And the specific tasks, there are 9 specific tasks of each sub-task group. And again, first is to identify regular programs, activities, and projects that should have implementation continuity. Again, despite of COVID, a lot of projects, activities, programs of government have to continue. And we have to make sure that they continue and being implemented. Second is to develop innovative delivery mechanisms, considering the new normal. Third is to develop program components that contribute to the fight against COVID-19. Integrate anti-COVID components into identified programs and projects. Identify programs, activities, and projects for sectors that are most adversely affected. Ensure complementation and convergence efforts of agencies and other task groups and sub-task group to maximize available resources. So it's important for the task group on recovery to again converge with the task group on mitigation, task group on strategic communications, to make sure that again activities and efforts are maximized. 7 is to recommend a communication strategy to achieve objectives of the task group on recovery, and then to monitor and evaluate the implementation of the PAPs and to provide feedback to the National Task Force on appropriate response. So given
Asakaloy?
yes, given that in terms of the specific task and that introduction to what TG recovery is, I would now again request Undersecretary Edillon to again follow through and discuss again what ReCharge PH is all about. Thank you very much, and Yusek Rose.
Yes, thank you very much, Asakaloy. My apologies because I was unavailable earlier, and my appreciation, sincere appreciation to Asakaloy for stepping in. So we're here now. So as mentioned earlier, may I ask who is Asakaloy is the one
I stopped
sharing the
sharing.
screen?
You can start again.
Okay, so I can share
Yes.
my screen.
You can.
Just a sec. Okay. Yeah. So I'm actually using the same slide as Asakaloy. Just to confirm, are you able to see my slide?
Yes, Yusek, we can.
Yeah, thank you. So just going back to this, because I was also monitoring the chat box. there are a lot of questions on this particular slide. So as mentioned earlier by Asakaloy, this is actually how we measure GDP. No? So we have the demand side and then the supply side. So on the demand side, you have here uh, household consumption, ang tawag dito, household consumption, and then investments. Sa investments, you have both public and private investments, you have government spending, and then exports minus imports. So taken together, ito ang tawag namin net exports. So in this pandemic, and like what we have seen during the second quarter GDP, no? So we see there that household consumption is down, okay, which is actually not a very good thing, no? Not a bad thing considering that consumption is easily 3/4 of the GDP. And then investments is down, both private and public. Net exports is also down kasi nga yung global demand is also down. And so, actually, during this time, the only way you can revitalize demand is actually to increase the G, which is the government spending, which is actually also what we did. That's why government embarked on a program on the small business wage subsidy and the social amelioration program. Now, this increase in the G will actually induce more production from either the agriculture, industry, or services. Okay, so this induced production will actually produce jobs, and then of course provide income to those who are employed by either the A, the I, or the S. Okay, so with these jobs and then the additional income, then we're hoping that that one will spur consumption. Okay, and hopefully private investments. And so you then have that, that virtuous cycle of increasing demand, and then you have the response, supply response, and then again, because of the jobs created and the income, then again, it leads to higher consumption, higher investments, and so on. Okay, but the problem is there is this COVID-19 threat, and therefore people that uh, have received additional income, okay, even the one that received the additional assistance from government might not actually want to spend it on consumption, and of course neither will they be spending it on investments, and therefore they might not save it up. Not bad in itself, but if you save it up in your house and not in the bank, then that will actually not be good for the economy, and therefore you will not have that virtuous cycle sana, no, na increasing demand and the supply response and then back yan. Now, it's really because of this COVID-19 threat. And therefore, and we also know that this threat of the COVID-19, the perception of the threat, is reinforced whenever we see the numbers on the COVID-19 infection. And therefore, even as we stimulate the economy, we actually emphasize the primacy of anti-COVID strategies. And that is actually the main reason behind the creation of this task group on recovery. So this is already mentioned by Asika Loy, that the task group on recovery is chaired by Daneda, and then co-chairs ang DOF and DBM. And then we have the 3 sub-task groups. DTI is the chair of the sub-task group on economic recovery. And then social recovery, DSWD is the chair. On the sub-task group on governance, the ILG is the chair. Now, we were doing this before Congress was hearing the Bayanihan 2, and so we didn't know if there will be additional money for this ReCharge program. And so the first thing we did was first identify those regular POPs. So meaning those programs and projects that are already budgeted in this 2020 GAA. And we need to pick and choose which ones of this do we think should have implementation continuity. So kunwari, mga supplementary feeding program, dapat matuloy yan. Yung mga anti-TB programs, dapat matuloy yan. So ito mga to. Next is we have to develop innovative delivery mechanisms considering the new normal. How do you implement the supplementary feeding na may social distancing, di ba? So ito yung mga kailangan pag-isipan. And then, and also specifically, what are the different program components that can contribute to the fight against COVID? And then these ones will be integrated in the identified PAPs. So let me just talk a bit about this COVID-19, yung fight natin against COVID-19, and how we think each individual, and in particular the social and economic sectors, can contribute to it. So we have here, ito na yung tinatawag na PDITR. Actually, the R here stands for reintegration. So these are the strategies. So P is prevent. So at the onset, we want to prevent transmission, the spread of this disease. And how do you do that? Well, among the susceptible population, which is actually every one of us, then there has to be a very aggressive communication campaign in order to inform everyone about COVID-19, how infectious it is, how you can get infected, and how you can protect yourself from being infected. Community also has to participate. Transport and mobility, and also the workplace and establishments need to ensure yung tinatawag natin na minimum health standards. So they need to ensure that their workers are safe and their customers are also safe, yung mga public-facing businesses especially. No? For those who are already exposed, okay, the intent is to be able to, detect yung mga exposed individuals, and that will be through contact tracing and health surveillance, and of course the testing. And in fact, even if you have not yet been tested, if you are actually experiencing symptoms, basta flu-like symptoms, kahit maliit lang na flu-like symptom, already isolate yourself. Okay? Kasi it's important that you do not be part of the, you are not among the ones circulating around. Kasi kapag nandyan ka sa labas, then you are actually spreading the virus. So you have to isolate yourself. In cases where we have identified, na merong clusters, the presence of clusters of this COVID-19, then communities will actually have to be isolated. Kasi ibig sabihin, nandyan na yan talaga. And then, for those confirmed cases, then we will need to treat them. Okay, and the treatment involves, in terms of the strategies we need for that. So yung health facilities and patient navigation. Kaya meron na tayong one hospital command of the DOH. And then among the healthcare workers, meron tayong tinatawag na substitution plan, yung care for the carers. So those, let's say yung ibang mga doctor to the barrios from Mindanao, pinadala for instance sa Cebu, siguro later na ipapadala ulit dito sa Manila, para may respite ng kaunti yung mga workers, healthcare workers natin in areas where with a high incidence of this COVID-19 infection. And then you have, of course, the equipment and supply, and then financial risk protection. And then finally, para do sa mga recovered patients, the intent is to have them reintegrated into the community, and then kung dati sila may trabaho, to be reintegrated in the workplace. And for this, we need to address the stigma. Some may still have mental health issues on this one, so kailangan i-address din yung psychosocial concern niya. And of course, the economic losses, for which there has to be financial assistance that is available. Now, what we did next was now to identify what are those different personnel requirement, goods and services that are required in order to implement this PDITR. Okay? So, kunwari ito, sa prevent. Okay? Yung prevent part. We will need to have cleaners, actually more cleaners. Okay? Safety and hygiene personnel. Okay? We will need masks, face shields, hand soap, sanitizer, alcohol, disinfectant. We will need to COVID-proof our businesses. So ito yung mga may plexiglass, yung iba cellophane lang na makapal. We will need health-boosting food and practices, services actually. For the detect, we will need health checkers, contact tracers, contact tracing encoders. And for this, we will need contact tracing app. Transport, communication, actually yung health surveillance app is also needed here. Okay? And so on. Okay? Sa isolation, sa treatment, sa recovery, marami actually pwedeng pasukan talaga. There are personnel services required, goods and services required in order to implement this PDITR. So this one tells us that even as we are fighting this COVID-19, okay, we can actually already restart social and economic activities. Okay? Even if we're just focusing muna on the fight against COVID. Maganda nga eh, kasi ang nangyayari is we're hitting two birds in one stone. We are actually addressing the COVID-19 pandemic, protecting ourselves, protecting our loved ones, and then we are also slowly restarting economic activity. So with that in mind, this is the strategic framework of the ReCharge PH. So right now, our goal is to have a healthy and resilient Philippines. And we have two intermediate outcomes desired. One is to reduce COVID-19 transmissions and non-COVID-19 deaths. The other is to restart social and economic activities. And we have four broad sets of interventions. One is contribution to PDI strategies by first compliance to the minimum health standards. Second is active involvement in the PDI strategies by being involved in contact tracing. Okay, I know that in some establishments, especially sa mga restaurants actually, and then sa mga ibang malls, no, where all customers are required to scan the QR or actually fill up, a sheet of paper just indicating your contact details. So makakatulong to, no, sa contact tracing. I just hope that those establishments take it a step further and digitize those forms. We can also contribute, social and economic sectors can contribute to the R strategies, by reducing economic losses and addressing the psychosocial concerns. And then, of course, yung business and service continuity has to be there, of course, but focusing on, we are looking at 5, no? Health system improvement, food security, learning continuity, digital transformation, and ecological integrity. Okay, we have seen that these are the 5 focus areas that will actually help in the fight against COVID. Okay, at the same time, building our resiliency. And then, of course, good governance, one that is inclusive and people-centered, responsive, clean, technology-enabled. Now, this overall framework is tweaked a bit or nuanced a bit and adapted to each of the SDG. And let me, I'll go back to this later. Let me just share with you how it was adapted for the SDG on economic recovery. So for instance, there's a contribution on PDI strategies. Well, we have COVID proofing of business, and then active involvement in the PDI protocol. So like I said, the health surveillance among your workers. We are actually also doing health surveillance among customers, and then also contact tracing. Okay, contribution to our strategies. Low or no interest business loans. Actually, the Bayanihan 2 will have more of this, but we're hoping that there will be other private sector initiatives also along this line. And then labor market facilitation. Okay, for those who will be displaced o kaya yung matagal silang naging isolated. So it's really about retooling, reskilling, and then being able to place them where they are, where they should be, where they can be more productive. Next is kunwari itong sa business and service continuity. Remember those 5 key areas, no? So how did we adapt this? So first, we think it should be about developing the PPE ecosystem. Okay. And then implementing, this is for government, implementing strategic stockpiling initiatives with strong linkages to domestic manufacturers. Okay. Then assistance to the agriculture sector and support to the food value chain. Ito na yung sa food security kanina. Following the entire chain from farm to plate. And then for the for learning continuity, it's about skills retraining and the retooling program. And then, of course, for the digital infrastructure, it's about the enhance, build, and including for digital infrastructure. Now, yung enhanced BBB dito is actually we are revisiting the list of the infrastructure flagship projects kasi gusto rin namin ulit i-focus dito sa health system improvement, food security, digital infrastructure. And then with respect to good governance, there has to be this active IEC campaign, okay? Business engagement, consumer protection dapat dito siya. Anyway, the reason why we have it here is because we want this active IEC and business engagement is really because ang laki ng pwedeng maitulong ng business sector, the business and actually the workforce in this fight against COVID. Okay. Of course, government needs to come up with the clear guidelines on the MHS and also on the enforcement protocol. Then, of course, yung ease of doing business and many more of this digital business to government transactions. So we want many more of the transactions, mga B2G, to be, you know, enabled, digitally enabled. Let me just go back no, to the outcome indicators na titingnan namin para dito sa TG. So we will be looking at, you know, new COVID-19 clusters in workplaces and malls. Okay, so this is how we will know that we are able to really engage all of society, in particular the social and economic sectors, while restarting social and economic activities. So dapat makikita namin kung nagkakaroon ba ng, you know, COVID-19 clusters that is actually identified with workplaces and malls. We will also be looking at the percentage of firms that are open and already operating at full or higher capacity. So for us, ito yung pinaka, you know, the very clear indication that we are able to strike that balance. Okay. Dito na rin yung percentage of firms with the hours of operation increased or remaining the same relative to pre-COVID status. And then, of course, yung mga displaced workers that we are able to, that are already working, currently working. And then sa social naman, titingnan yung mga, sa social sector, new COVID cases among school children, okay, and proportion of children engage in any education or learning activities. So again, you want to make sure that, you know, may balance ka. So they are able to return to school or not really school. They are able to continue their learning process. And at the same time, you do not see new COVID-19 cases among school children. And then there's increase, we will be looking at the incidence of foods insecurity among the households, and that looking at, again, COVID-19 cases among the social welfare program beneficiaries. It's actually important that yung mismong involved in this COVID-19 fight should really be the ones that are able to demonstrate success ba in fighting this COVID-19. Kaya tinitingnan namin din yung mga mga program implementers, how many of them are actually infected. So ganun din dito, no? Yung mga associated with public spaces, okay? So yung mga NG offices and LGU offices and so on. And then yung percentage of tests initiated through contact tracing by government or contact tracing by workplaces, and confirmed cases discovered through contact tracing by government, and then doon naman sa workplaces. And then also those households that have been covered by health surveillance protocol. So ito yung mga mga titingnan namin dito. Okay. Let me just go to very quickly. Oh, this is too long. Sorry. Sorry about this. Okay. I actually opened the original very, very long file. I'm sorry. There. So for the social sector, this is how we are tweaking that, again, that general framework. So almost the same for the contribution to PDI strategies. And then for the contribution to our strategies, it's about the mental health and psychosocial services, and then universal and transformative social protection. Tapos, on the business and service continuity, ito yung mga health promotive na programs, activities, and projects. And so we have the social development agencies identify all these different POPs sa health that that we think should have implementation continuity. And then training on DIY mask making and making of PPEs. Ang usapan namin doon is, you know, this doesn't have to be commercial scale. This pwede kasi yung sa kanila lang eh. Let's say the 4-piece beneficiaries will be taught how to use this DIY mask so that when they go out, then they can actually protect themselves and their family. Then proper nutrition and food preparation, and then flexible and continuous learning opportunities for all. On the good governance side, again, nandun na naman yung active IEC campaign, and then engagement with the social protection beneficiaries, because some of them can actually be engaged to do health surveillance, kahit yung kamustahan lang with their kapwa SP beneficiary. And then, of course, government needs to come up with the clear guidelines on the minimum health standards, social protection, implementation, and the SAP, the social amelioration packages. And of course, the enforcement protocol. So ito rin, under good governance, we are challenging the social development agencies to come up with innovative delivery mechanisms. So far, way ahead in the preparation stage, yung nasa education sectors natin. So they have to come up with this flexible learning delivery system. And then going forward, we're looking towards making use of a digital registry for the beneficiaries for this SAP and other, you know, mga wage subsidies. Sana maging may ayos na yung registry natin. So let me just proceed next to this one. This is for the SDG and governance. So for the governance, okay, so this is for the governance related. So it's actually almost all of government, no? Pero ang kasama dito kasi would be this so many agencies, including yung mga those engaging with the civil society. So nandyan yung National Youth Commission, nandyan ang National Council on Muslim Filipinos, nandyan yung Council for the Welfare of Children, nandyan yung NCIP, nandyan din yung NCDA, and so on. And nandyan ang PNVISCA. That's the Philippine National Volunteer Service Coordination Agency. So, and then of course you have the leagues ng local government units. So ito yung mga magiging, this will be their guiding framework. So first, active involvement in the PDI protocols with respect to health surveillance, contact tracing, and then enforcement of the quarantine protocols. And then contribution to the R strategies as with the social sector. Then sa business and service continuity to focus on O&M of the temporary treatment and management facilities, and of course the health facilities. Okay, kasi marami dito are you know, publicly managed. And then provision of land for community gardens and planting implements for home gardens. So this is for the food security part. Support to learning continuity, support to digital transformation, okay? And then of course yung ecological waste management. So there will be in line with this, not lalo na dun sa economic recovery SDG, the DTI has actually been engaging with the various businesses, baka yung iba nandito, no, in order to repurpose their business so that they support the PPE ecosystem. But in so doing, many of them will actually need to secure, different sets of permits, a new set of permits. And so we're hoping that we're actually agreement namin under this SDG on governance that these agencies will have to be facilitative, supportive and facilitative of this transition to the new normal. So with respect to good governance, they will be harnessing industry and shared public service values through CSO partnerships and citizens engagement. Okay? Of course, yung continuity in the delivery of public services will be there. And then making sure that, they use technology-enabled platforms to upscale transparency and accountability mechanisms. So that is actually our plan to recharge the economy. But of course, this is actually a very short-term plan. Okay? And going forward, we're actually updating the PDP. Hope to finish this within the month, okay, at least the draft. And what we're doing is really to refocus yung mga strategies and actually direct them towards having, a healthy and resilient Philippines. Ito, pinalitan namin yung the goal of the PDP. This used to be a very long one. If you're familiar with the PDP, ang dating goal nito is to lay down the foundation for inclusive growth, a high trust and resilient society, and a globally competitive knowledge economy. This is actually geared towards the ambition. Matatag, maginhawa at panatag na buhay. We have actually made the determination that the vision remains the same. Okay, this is ambition natin 2040. Siguro kailangan lang na we have to be super mindful that there are many dimensions to this ambition. Matatag, maginhawa, and especially panatag. So yon. So talagang ang magiging, we will be giving equal weights to these three dimensions. And I think right now, in the immediate 2 years, we have to focus on the resiliency, the panatag part. So we have tweaked the different strategies here to make sure that they are now geared towards having a healthy and resilient Philippines. And that is the end of my presentation. I'm now open to accept questions.
Thank you. Thank you very much, Yusek Rose and Asek Kaloy, for that presentation on the objectives, the framework, and even the governance structure of ReCharge PH. Yusek, before we go into the Q&A, I would just like to present, because earlier we did a poll. We did 3 poll questions just to sync the mindset and consciousness of people on what you presented. So if you don't mind, Yusek, I would just like to show the results first and maybe some insights from you, ma'am, on the results. So can we put up the results of the first poll question? The question was, ma'am, what changes in the way your company does business do you expect in the new normal? And the results show that about at least 75% said new work arrangements. And they're expecting more online transactions, followed by at least more than half say increased automation of business processes. And then the rest would say new skill requirements, new products and services, and then others. So ma'am, that's the result of our first poll. Ma'am, would you want me to present first the results of the 3 because they are interrelated anyway?
Okay, sure.
Thank you. Can we see the results of the second poll question? And the question, that was a multiple response question, ma'am. And the second question was, what do you think will be the most difficult challenge your company will face transitioning to the new normal? And majority, or at least 67% said maintaining employment, followed by another challenge is on market or the demand for their products and services. And then about 46% said access to technology. 40% said government regulation. And I think, ma'am, this has something to do with our health protocols that will remain in place in the next 2 years, maybe, and then supply of raw materials, and then others. And then our last poll question asked the participants how confident they are. Can we see the last poll? How confident they are that their company will be able to fully recover in the new normal. And 53% said neutral bang, medyo somewhat confident. Only 37% said they're very confident. 5% said they're not confident. And another 5 are uncertain on the level of confidence that their company will be able to fully recover in the new normal. So, ma'am, these were the results of our poll questions. May we request your insights on this given your earlier presentation?
Yes. Yeah, thank you. Thank you, Patty. I will accept the 90%. Kasi 5% not confident, 5% don't know. Big sabihin, meron kang 90%. Wow. 90% who are confident that they will, they will be able to make it in the new normal. So, we have actually we're aware of this of these issues, no? For the first poll question, I think it was already mentioned by Asek Kaloy kanina, no? So what we think about the new normal, what will be its implication on different aspects of demand, and also of course the work arrangements. And we're actually happy that there is this acceptance that there should be this transformation towards greater digitalization. Truly, this is actually one way that we can be resilient, so that even if in the future, uh, we really think that this crisis, or this experience we have of having this health problem or health crisis, mukhang papunta na tayo dito no? So parang siguro going forward, there will be a lot more of this occurrences. Hopefully not, knock on wood pa rin. But in case that happens, then we want to make sure that when that time comes, and if we have to go on, community quarantines ulit, mga lockdown, then that should not be equivalent to economic inactivity. So yun ang naging problema natin dito. Nag-lockdown tayo, and we found during our survey in April that only 12.4% of businesses were able to implement work from home arrangements. And for that tells us that there's a very, very low level of digitalization. So yes, I'm glad that there's that acceptance, and I think this is also the reason why we have increased the budget of the DICT. Okay, and actually, ano na sila, they now have that sense of urgency that they really need to increase internet access. Okay, so we're talking about digital transformation, pero ang dapat kaakibat niya, suporta diyan, is the digital infrastructure. So we're hoping that we can get the third telco soon, and then we're hoping as well that the DICT will be able to put up more of this digital infrastructure. At present, what we have done is really to find out how we can address, by way of executive action, all those different barriers to having this digital infrastructure. Kunwari, so meron ng EO on the common tower sharing. Yan. So meron na executive order on that, and then ang susunod dyan is a common pole sharing. Pero lahat to kailangan natin EEO. So anyway, so kasama yon. And then of course we have the TESDA as well, that is coming up with a number of training programs, okay, that have to do with ito yung sinasabi niya na digital upskilling. So kasama na rin 'yon sa nakalatag. Okay? And then maintaining employment. Actually, itong sa maintaining employment is also closely related dun sa sinasabi nyo na problema with the lower demand. And this has to do also with that, yung illustration ko kanina about the lower demand, kahit na increase natin ng G, kung halimbawa, hindi naman, the confidence is not there of consumers, for consumers to consume more and for investors to invest more, then you don't have that nice cycle, nice feedback. No? And so we really need to address this COVID-19 problem that we have. But we think that with the help of everybody, and we're finding out that there are a lot of ways that we can actually protect ourselves from getting infected. And we think that if we can get everybody to help contribute to this COVID-19 fight, and so all the more na, lalakas din yung confidence nila to be able to participate in social and economic activities again. Of course, not letting their guard down. Ang sinasabi na nga namin ngayon, we will be having a change in the communication strategy, is tong minimum health standards na to, this have to be practiced 24/7. Okay? Kasi ang na-observe natin, yung mga contagion, actually they happen in the homes. 'Di ba? Yung mga pamilya, sila ang nagkakahawahan. So that means those going outside, okay, naka-mask, naka-face shield, pagdating sa bahay, agad-agad nagbeso-beso. Yan, agad-agad nagmano, nagkiss. Dapat hindi ganoon. Dapat unang gawin pagdating sa bahay, you disinfect yourself. Wash your hands, take a bath if possible. Tapos yung ganoon bago kayo mag-interact. Proper coughing and sneezing etiquette, i-practice pa rin sa bahay. So these are things that we can do. So the government regulations, there will be with the Bayanihan 2, actually. Bayanihan 2, there will be some assistance actually, especially for the transport sector. Kasi sila talaga ang we will be requiring them na kasi yung design ng jeepney natin, kasi hindi ko ba alam kung bakit harapan, no? so there's actually a lot of impact talaga on the transport sector, and therefore there's actually very, very serious discussion on how we can mitigate this negative impact. Yung sinasabi nga na may service contracting. So there will be funds available for the transport sector and also for the other sectors na as they to help them transition in this new normal. Thank you.
Thank you, Yusek Rose, for explaining and making clear to our participants that response and support measures are actually in place and that government is cognizant of all these concerns. Yusek, before we go into the Q&A, I'd like to pitch the first question. I think that's the advantage of hosting or moderating the session. So coming from government, you said a while ago that on the issue of funding, since we do not have, correct me if I'm wrong, Yusek, you are saying we don't have new revenues, and then C plus I is down, only G is working, and then even the net exports is down. When you look at the PAPs, what need continuity in implementation, was the PDITR framework essential in determining which PAPs which PAPs the implementation should be continued?
Yes, of course. Let me just correct that. No, what we did actually was to the first thing we did was to reprogram our budget. We have a very sophisticated or complicated or actually a very rigid budget process, and that was actually for a reason, para there's really this prudential fiscal management. So the first thing we did was to reprogram our government budget, looking at those PAPs that will probably no longer be implemented kasi nga naka-lockdown. Okay? So lahat ng mga conferences natin, lahat ng mga budget for, attending meetings abroad, yung mga lahat yan, tanggal. And then dedicated to the COVID fight. Okay? So So that was actually what we have, what we used for the first Bayanihan 1. Okay, so actually by the accounts of DBM, we have already spent more than 300 billion para sa ano, sa Bayanihan 1. So under the Bayanihan 2, it's now about yung tinatawag namin na hammer and dance. So it's about the second phase na, and the amount is 140 billion. Again, kasi gusto natin maging prudent pa rin tayo, no? We don't want to yung masyadong hangga-hangga rin, because we don't really know until when this crisis will last, and we don't want to, we don't want the situation where masyadong naging marami yung utang ng ating mga anak, no? Yan, parang tayo pati, no, nung tayong naging adult, nakita natin, uy, ang daming utang ng gobyerno. Inutang nila no, tapos tayo magbabayad. So ngayon, we want to be more responsible. Yan. So yun ang nagiging what's this philosophy doon. We want to make sure that we use all the arsenal that's available to us, including yung making use of our government financial institutions, making use of our guarantee, yung Phil Guarantee Corporation natin, making use of all this para we can leverage yung ating funding. Now you're asking about yung sa POPs that will have implementation continuity, that should have implementation continuity. Yes, actually naging guide din namin yung PDITR. And that's also the reason why we have this yung 5 na focus areas on health system improvement, kasi nga it's a health problem, kailangan ng health solution. Yan. So, yun ang inano namin. So, what is it about health system improvement? Oh, dapat maayos yung ating PPE stockpile, di ba? Dapat tayo mismo malakas ang ating katawan. So, yung mga non-COVID dapat protected din tayo against that. So, yun ang inano sa health system improvement. Food security is also very important. Yun. Kaya doon din nakapasok yung mga different assistance to our agriculture sector. And then learning continuity. Yun. Kapag if we do not continue yung learning activities ng ating mga anak, then it will really set them back at least a year, pwedeng mas matagal pa. So kailangan talaga to the best that our best efforts to make sure that they go back to learning. And then of course yung digital infrastructure, and then yung ecological integrity. So tinignan namin kung ano yung kailangan ng PDITR. Like I said, it's we want to be shooting 2 birds with 1 stone, helping in the COVID-19 fight. Okay, actually 3, no? And then building our resilience, and at the same time restarting social and economic activity.
Yeah. Thank you, ma'am. Last question na lang from my end, ma'am. When you did this PDITR, was there information already or indication even from the experts on when vaccines will be available? Sorry, I have to go into that.
Yeah. Actually, the PDITR was first formulated by the NTF, National Task Force Against COVID-19. Okay, we didn't used to be part of the task force, the NTF. I think it was also mentioned kanina ni Asek Kaloy, no? Nung nakita ng NTF that papunta na tayo sa second phase of this action plan, we need to bring in na yung the social and economic sectors. Yun, kaya nagkaroon ito. And so, kaya pumasok yan. Now, you mentioned about the vaccine. Actually, we have been in close contact with the WHO, and we have always been monitoring yung mga international experts, international na mga health groups. So, ang namin is, we'd rather be paano ba to? More strategic. We don't want to really put our hopes into before the end of the year, may vaccine na. Yan. We are actually being very, very realistic in that we know that 8 billion people will be requiring this vaccine. So parang ang hirap yata. So parang, if they can produce 1 million a day, how many days will it take, okay, for them to produce that 8 billion? So we are actually being more realistic. As per our planning, not in this one, kasi itong recharge na to is really very, very short term, until end of the year lang to. Pero yung updating of the PDP, in that updating of the PDP, ang aming assumption is that we will probably get the vaccine late next year. Yeah. But even then, we are already gearing up towards being more resilient against this COVID-19, and hopefully against other health problems that might come our way.
Thank you, Yusek. Yusek will now go to the Q&A box. And I'd like to start with this question dedicated to you. For Ma'am Rose, what is the recommended business in this kind of pandemic to help people who lost their job? Some of the questions are really it really hits home, ma'am. So that was the first question.
Yeah. I think it was already answered kanina, no? It's really to do with yung mga digital solutions. We think that many businesses, yung sabi ko kanina, 12.4. So ibig sabihin, you're looking at 87.6, mga 88%. Yan, 88% of businesses that will have to go digital. So may proseso rin yan, hindi ganun kabilis yan, no? That means that they will need to come up with mga applications. Yan. So we will need somebody to write up those applications. Yan. Mga businesses, accounting procedures nila, personnel, all this, mga documents nila will have to be digitized. Actually, yun ang unang-unang pwedeng gawin dito. Yung magkaroon ng optical scan of the documents so that they can be readable digitally. So yun yung digitization part. And then that one in itself will already require lots of personal services actually. In terms of equipment, hindi siya ganun ka equipment heavy. You just need an optical reader. Okay, of course, the person who will do the scan. And then, yung susunod na yun is somebody who will write up the program for you. Yung magiging app. Of course, you can have yung ready, anong tawag doon? Yung mga nabibili mo lang. Pwedeng ganon. Yan. But you can have it customized. But you can also have it customized. And so I think that's also one of the good businesses. Of course, going down, may mga level to, no? So that's for the tertiary part. So secondary, we will be requiring more of the face masks still, okay? Mga PPEs natin, hand wash, hand soap, and yung sinasabi namin na mga health boosting goods. Yan, food, vitamins, yan, magiging in talaga yan. Mga malunggay, mga moringa, mga ganyan.
People are more health conscious, ma'am? They're more health conscious now.
Yes.
Okay. 2 more questions, ma'am. Can we?
Okay, sure.
Okay, the next is, in your own opinion, ma'am, can the ambition natin PDP help the country navigate in the new normal? Or are there pieces in that plan that are missing, taking into consideration that the plan was done without a pandemic in mind?
Yes. Actually, the lesson for us, no? So, as we update this PDP, taking stock of the lessons from this COVID-19, the lesson for us really is being mindful that the ambition actually has 3 dimensions to it. Okay? Matatag. So to do with more of our relational yung mga aspirations, having more time with family, friends, community. Maginhawa, ito yung mga economic growth, ito yung mga vacation, housing, transport. Pangatlo yung panatag. Okay, and this really has to do with resiliency. Also your financial stability, your financial security. Kasama na rin yung, peace and security. Pero kasama rin dito yung health security. So para ang nakita nga namin doon is we really need to give equal weights to all these three dimensions. Hindi po pwede na parang kasi marami naman tayo sa gobyerno, di ba? So
Yeah.
so lahat tayo dapat itong tinitingnan that let's say you're in business, you have to make sure that to the extent that you can, you help towards making your workers financially secure, 'di ba? So kaya dito rin yung mga as much as possible naka-ATM yung kanilang mga sweldo at turuan din sila ng ang tawag doon, yung financial literacy, na wag naman nilang gastusin lahat, no? So kailangan may naiiwan. Mga ganitong klase ba? So yun ang learning namin dito. It's still very relevant, we think, no? Yung vision natin 2040 is still very relevant with respect to the PDP. A number of strategies there are actually also still relevant, but we need to have a greater sense of urgency, especially with respect to building our resiliency. Thank you.
Thank you, ma'am. The next question is, ma'am, MSMEs are complaining of too much regulation even in time of pandemic. Are there talks of reviewing the layered requirements and regulations being asked from enterprises?
Yes, if you're talking about the minimum health standards, well, yes, these are constantly under review, no? Pero again, as I said, we are actually trying to balance, no? We want to be able to open the entire economy. Okay, we want to be able to reopen every business. Pero they have varying risks with respect to the spread of the COVID-19. So especially those businesses that rely on having crowds. Yan, yung mga yan. So ito yung mga business models nila may crowds. So like yung mga sinihan, mga concerts, mga ganito. But we're seeing that in other countries they are able to innovate. No? I just read on the news kanina that sa MOA daw magkakaroon na ng drive-through cinema. Yes. May mga ganun eh. It's really a challenge, no? Pero I think it can be done. Meron nang ginawa in Europe na again concert, pero meron silang mga yung bubble ba? So ganun tipo. So and I think it's really, like I said, it's really about achieving this balance. We want to reopen the economy, but we don't want to sacrifice the health and safety of the people, no? Your workers and also your customers. So but like I said, no, continuous naman yung knowledge banking dito. The studies that are being done both here and abroad, and kung nakita namin na ito hindi na to kailangan, then we will be NEDA will be the first to recommend that this be taken out. Yeah. Thank you.
Thank you, ma'am. I'm sure the participant, whoever he is or she is was very pleased with your response. Medyo naale yung fears niya of layered government regulation. Ma'am, we have another question here. This is from Edie Chris. She says, Yusek, what is the funding prioritization for Bayanihan 2 identified programs? Is it heavy on loans for enterprises or on health-related concerns? Why, and have we considered the multiplier effect of each priority intervention? Although earlier, ma'am, you said a while ago that Bayanihan 2 will focus on transport. Tama ba, ma'am? Transport workers? Yeah.
No. Sabi nga ng DBM, as soon as it is signed, ibababa kaagad yung 140 billion.
Yeah.
Okay? So, wala in terms of sequencing.
Wala na.
So, lahat nandun. So, there's the provision of equity infusion for our government financial institutions para sa pag-provide ng low interest loans, interest rate subsidies. So yung mga yon, there's also the small business wage subsidy, of course. Meron ding cash for work. With respect to the health expenditure, bale we actually came up with the determination of ano pa ang kulang. Okay? Kasi with respect to, let's say, the PPE stockpile, we have already done the stockpiling. Kaya nga, early on in the Bayanihan 1, so even nga not the Bayanihan, basta yung naging yung nag-reprogram tayo ng spending, marami doon napunta sa sa health. Yan. For let's say for the testing kit, meron na tayo until December. So na advance order na natin even the PPEs. I think yun yung nagiging complaint ng ating mga domestic PPE manufacturers, hindi daw sa kanila bumibili ang gobyerno. Ang problema kasi is na order natin sila nung May, and then they're just coming in batches. Yun. So ganun yung niya si STE. It's not really because we are prioritizing yung mga foreign manufacturers, except that during that time that government ordered for these PPEs, wala naman tayong domestic manufacturer. So ganun siya. So but now that they're coming online, yung mga susunod na orders for sure will already be preferring the domestic manufacturers. In fact, it's in the Bayanihan too. Yeah, thank you.
So thank you, ma'am. I think this ends our session, ma'am, unless you have a few words you'd like to leave to our participants. Alam mo, marami sa amin pa rin ay, very, fearful and uncertain, fearful of going to work, uncertain of what the future will bring. So maybe, ma'am, a few words from you before we end.
Yes, thank you. Thank you very much for this opportunity, and really my apologies that I couldn't be with you earlier, and of course my thanks to Asek Kaloy for pitching in. But just to make a point that there's really a lot that we can do, both to help restart the economy and to help in this fight against COVID-19. So we have been through a lot of problems before. We've been through a lot of tawag namin shocks, no? Shocks before, and we came out of that, and supposedly this 2020, we are actually on our way towards being an upper middle income country, and we think that we can still catch up. We can still catch up. We just actually released the labor force survey today, kanina, yun yung press ko namin kanina, and you know what? Between April, the April round of the LFS and the July round of the LFS, April we had the total lockdown, ECQ in many countries in many parts of the country. July, nag-ease tayo ng restrictions somewhat, okay? Between that period of time, we were able to create 7.5 million jobs. Okay? So, pwedeng mabilis natin itong magawa itong bounce back na to, but it requires really the cooperation of everyone. And we think that everyone contributing, we're able to to contain the spread of this COVID-19 at the same time that we are also gaining confidence amidst this pandemic na kaya pala natin Yan, kaya pala natin to. And that is really the way to have a more robust recovery, social and economic recovery going forward. Thank you very much.
With that, we'd like to thank Undersecretary Rosemarie Edillon, who also happens to be the Vice Chairperson of the National Wages and Productivity Commission. Ma'am, our deepest and sincerest gratitude for those comforting words of positivity and optimism. And we join NEDA, the civil society, in supporting ReCharge PH. Thank you, ma'am. Thank you very much. And we'd like to thank you, ma'am. And we'd like to thank all our participants for joining the poll and participating and engaging us in our chat box and our Q&A. We apologize that we were not able to raise all of your questions, but rest assured that we will email Yusek Rose all your questions. So before you leave, I'd like to remind the participants to please fill up our evaluation form to help us improve further the way we run our webinar series, which in fact will run from today until November 5. So just a reminder, our next webinar is on September 10 with Department of Trade and Industry Undersecretary Rafaelita Aldaba on the subject, Automating Workplaces in a Better Normal. And then on September 17, again a Thursday, we will be having the Department of Science and Technology talking about technology-enabled solutions, mitigation to recovery. And then on September 24, we were privileged to have been granted the opportunity for the ILO Enterprise Development Specialist, Mr. Hideki Kagohashi, to share his thoughts on the future of work in the new normal. So for October, October 1, we have Director of Employment, ILO Director of Employment Policy Department, Mr. Sang-Yun V, to talk about the employment outlook, transitioning to a better normal. On October 8, we have National University of Singapore Professor Keith Carter to talk about actionable intelligence, results amid uncertainty. So for those interested in big data, we invite you to listen to Professor Keith Carter, who is an expert on the topic. On October 15, we have LeadWorks Business Solutions founder, Jasmine Flores, to talk about business reconfiguration. So for those already planning to bounce back or bouncing back into the new normal, the talk will be on how businesses can reconfigure in order to be productive and to sustain efficiency in the new normal. On October 22, we will have a talk on employee engagement. And then on November 5, a talk on automation in agriculture from Session Groceries. So this is the long list of our webinar series, which will run until November 5. And so with that, again, on behalf of Secretary Sylvester H. Bello III, Executive Director Maria Criselda RC, our speakers, Undersecretary Rosemarie Edillon and Assistant Secretary Carlos Abad Santos, we'd like to thank everyone for participating in this webinar and see you again next Thursday, September 10, same time. Thank you and goodbye. Please don't forget your evaluation. Thank you.